PSIS when we did the right hip abduction, flexion, internal rotation. So we'll recheck that. Shoulders were a little funky. The triceps seemed to clear that again. So now that you're feeling that tricep a little more, I'm kind of expecting that to hold. So, and then hip extension on the left, interestingly enough, was actually good last time. Previously, we saw prone was high quality, but supine was low quality.
Okay.
And I think that has a lot to do with the lumbar, the flexion stuff. So I'm kind of expect that one to be okay today. And then SARS 6, flexion, abduction, external rotation on the right was low quality, no pain. The side bend cleared that stuff. And then we got into the neck, which were both low quality. So I'm thinking those will be a little bit better today. Because you can rotate without that pain response now, right? So
yeah.
Let's see what this does. Slide the leg out, hold, ready, go. Good, no pain. Slide the leg out, hold, ready, go. Good, no pain.
No.
Turn in, lift up and out, ready and go. Good, I feel okay?
Yeah.
Out, ready to go.
That feels good too.
Good, there was no pull anywhere when we did that right leg.
Yeah.
Cool, because last time I said pull on the left. So your system is stabilizing and it's liking what we're doing, clearly, right? It's locking in. Shoulders, glenohumeral extension. Keep the hand down on the table. Ready and go. It's a little hard to do still, isn't it?
In my head, I'm like, activate the tricep.
Did you feel the tricep going that time? Yeah. Ready and go. Okay, so I'm not sure those are your triceps. Let's check. Hold. Ready and go. Yeah, so you can't hold it from above the elbow either, right?
Yeah.
So it's not all tricep. Yeah, we know the tricep was low quality, so we had to check that off the list and work it. But I don't think that's what's stabilizing this entirely. Ready and go. Yeah, it's a little funky on both sides. Bend your knees. Tighten your belly. Chest tall. Yeah, do the whole thing there, right? Now stay down. Ready to go. Roll these shoulder blades back and down, and then hold down from here. Ready and go. There you go. Feel how you stop me?
Yeah.
Nice. So retraction, right? So there's the second piece of this whole thing here, especially the extension part of the glenohumeral. I don't think it's all tricep is the problem.
Okay.
I think it's, again, the spine not being able to get here, right? Which ties into the neck thing that we were working on a little bit.
Right.
Okay, so shoulders still a little low. Let me double check the hips. So stretch your legs back out. Stay down. I'm gonna try to lift your leg. Ready and go. Good. Trying to stop me there. Ready and go. There it is. Nice. Ready and go. Good. I was like, last time that wasn't a problem. That'd be weird if it was that mushy today. No, you're good. Okay, let's try the flamingo. Pelvic rotation. Yes, perfect. Twist. Hold. Ready to go. Ready to go. Yeah, I think you got it. No pain?
No pain.
This one, we really put a focus on that left side bend doing this, right? Hold. Ready to go. Oh yeah. Do you feel that click in?
Yeah.
Yeah. Nice. Okay. Flexion, abduction, external rotation. The side bend left, stabilize this right leg. We're doing this one too. Turn the leg out. Lift. Hold this position. Keep your knee locked. Ready and go. Yep, good. High quality. No pain.
Okay.
Lift. Hold. Go. Good. No pain?
No pain. No pinching in my lower back either, which is good.
Which is, again, now that we've started that flexion is what I think the theory is, right? We've done that.
Yeah.
This.
And to do flexion, it helped me to put my hand on my back to make sure that part of my back was actually moving. Because if I'm not doing that, I was moving the wrong part of my back.
Just the upper back stuff, not aware of it, Closing that feedback loop, it's huge, right? A really obvious example of that is like the mirror. You're like, where? I don't know. Oh, right? It completes the circuit, basically. Yeah, that's great feedback. Okay, let's check the neck. So this is our SARS. Last time you couldn't hold either of these, but you also, it's a big rotation. You also couldn't rotate without pain. So I think this should probably be cleared. Let's find out. lift. And took the chin a little more and you lift and get okay there. And then rotate. Any pain getting there?
No.
Okay, hold here. Ready, and go. Hey, look at that. Rotate, hold, go. Nice job.
That's what I mean, no pain. Like before when I turned this way, it was pain.
Yeah, you couldn't even turn it, right?
Yeah.
Without hurting. Yeah. Which makes sense why you couldn't hold it, right? Again, the hot stove, your body felt a pain response. So it's going to avoid further injury. Because if you try to hold it through the pain, you know, we could rip or tear or break something. Or
Right.
the pain is just an indicator that it's something's not right. That's all that is, yeah. Okay, very good. So SARS check, we're pretty locked in. I don't think anything except for maybe the shoulders was a little funky. We're going to talk about the thoracic extension as it relates to the shoulders in a minute. But let's go ahead and run some more samples on that left lower extremity, or sorry, left upper extremity, the left shoulder here. So that we have today's baseline, see if any of the low quality samples from last time are the same. And then we'll get into more of the trunk and spine training, neck training, and then recheck before we intervene directly with the shoulder.
Okay.
So let me get this abduction baseline, just slide up and out. Already.
Yeah. It stops there, but
Did it stop because of pain or it feels blocked?
blocked.
Okay, so you didn't even get a pain response doing that.
Right.
Okay. Let's try it out here. Not really different.
Locked there, but no pain.
Okay. Cool. So that's a great start, right? At least we're getting rid of that pain response.
Yeah.
Check your external rotation. Turn this way. Yeah, that gets weird right away.
Does my shoulder pop up when I?
Yeah, and something here too. Like you're like fighting me through here. Like this got rigid.
Yeah.
Yeah, so you're doing like that.
I can feel my shoulder go, like even that small movement right there.
Blocked or
Yeah.
pain?
Blocked.
Okay. So abduction, range of motion is limited, but we're not getting the pain response. That's good. Which even last appointment you were getting pain with the abduction. So something has already changed again from last week. That's good. And external rotation, that one we just did no pain, just blocks.
No pain, yeah. My Pilates teacher was concerned about my shoulder. She was like, "What is going on with your shoulder?"
It's not super obvious what's going on.
Yeah.
Yeah. This is why I think it's the spine, but let's keep checking here a little bit. Hold here. I'm gonna try to open your arm up. Don't overdo it. Ready. Go. Nice. That didn't feel like too much pec. That's all laddie, right? Back
Yeah,
there?
yep.
Okay, so that's high quality, no pain.
No.
Okay. So adduction, which is also interesting because last time it was low quality. So some fundamental things are changing here already. Got the lat activation, that's good. Okay, let me check your internal rotation, turn it in. That's the humerus, sorry. Hold. Ready, and go. Like that. Ready to go. Any pain?
No.
Okay, let me check the external again. Even though the range is limited, let me just see if you can hold this. I'm gonna try to push you back. Yeah, ready to go. It's not terrible. No pain doing that.
No pain.
Internal rotation, low quality.
I just feel my shoulder go too. It's weird.
Like moving?
Yeah, like it pops forward, or I'm trying to overcompensate.
Yeah, it does this, right?
Yeah.
Yep. So you're compressing the AC joint, you're not getting retraction, not getting depression, probably the shoulder blade. Let me check elevation and depression. Shrug. Does that get smashy in the collarbone there? Does it
A little
feel-
bit.
Yeah. Hold. Ready and go. Try it again. Ready and go. It's not great. Let me compare to the right side. Sometimes until you compare, it's not obvious. Hold. There you go. Oh yeah.
Yeah.
Way different, huh?
Yeah.
Elevation. Scapular elevation here. recheck the depression of the shoulder blades. I'm gonna get kind of in your armpit here. Is that okay right there?
Yeah.
Straighten the arm again. And then reach towards your feet. Dude, that got weird.
Yeah.
Hold. And push it back up. There you go. Yeah, no, don't
No.
have that one either. Did that hurt your armpit? You
Didn't
okay?
hurt, no, I just pinched.
Where?
Like up
Ah,
here.
up in the top. Yeah, so that AC joint smashed there. Okay. So first things first, let's turn on, let me double check retraction real quick too. Reach to the ceiling. Roll that shoulder blade back. Hold that position and pull it out. Ready to go. Doesn't feel great either, huh? It's kind of moving a little
Yeah.
bit. Okay. Let's work the elevation frequently with this abduction. If I'm not using my trap to get there a little bit, I'm pretty done at 90 degrees.
Yeah.
And then I can get there more. So I'm curious if it's going to be a myometric tissue control issue through the elevators, or if it's going to be a plyometric control issue through those depressors. Because either of those you couldn't hold, right?
Right.
So let's start with the elevation. Roll back, and then shrug, keeping it back right there. You should feel that all in the trap.
Mm-hmm.
Yeah, already, huh?
Yeah.
10, 9.
5.
A lot of work. 6 like a rear trap.
Yeah.
3, 2, 1. Rest.
It feels good though, like a stretch. Really good stretch.
The trap felt stretchy.
Yeah.
Weird.
Yeah.
Okay.
Maybe it's because my neck muscles are always just so like.
doing,
Yeah.
holding it up. Yeah, that's very possible. Nice. Okay, so shoulder samples. A lot of those going on. We're gonna start with the elevation. We're gonna do that again. A couple more isos, and then we'll mime it. Shrug again. Oh, sorry. Keep it rolled back before you shrug. Yeah, now shrug. Good. Find that same trap tissue. You got it? Okay, now I'm gonna let your elbow back out without letting that shoulder roll forwards. So keep the shoulder into the table. Nice job. Do you feel it almost wanting to move around?
Yep.
Is your trap still on?
Yeah.
Good. 5, 4, 3, 2, 1, and rest. Good. That's you. Do you need that?
Probably not.
Okay.
It's not my work phone, so probably not.
Love it. Okay. Let's try a couple myos now this time. So I want to do it with your elbow out. When you do it here, the arm is going to go out to the side a little bit. Right?
Okay.
So you're not doing like this smashing. Let it kind of,
Go out. Okay.
yeah. So roll it back. Shrug. There you go. Feel how that got weird there? It got sticky.
Yeah.
Roll it back. That. Keep it there. Shrug. Nice. Let's go again.
Like popped.
Up in the collarbone?
Like back here.
Oh,
Popping
scapula.
is another part. Like I'll do exercises and it will be really poppy. Yeah.
Yeah, that's a weird move for you to do, isn't it? Just a couple more. Keep it back and shrug it out. Nice. Now we're going.
Yeah.
Couple more. Feeling the trap working?
Mm-hmm.
And then hold. Just cooking that trap for another 10, 9, 8, 7, we're chilling here, 6, 5, 4, 3, 2, 1, rest. You okay there?
Yeah.
Yes. Give it a couple seconds of rest, and then we're going to recheck your abduction and see what the influence from this elevation was there. Lots of trap work. Extending the elbow. Okay, let's recheck the shrug. So just roll it back and shrug it. Hold, ready, and go. That feels better than it did, huh?
Yeah.
And you feel the trap engage in there?
Yep.
Not getting the smashy feeling in here?
Right.
Okay. Let's recheck your abduction. Start abducting. And shrug. There we go.
Mm-hmm.
Alright, so we still want to get it compy there. Let's not lift off the table. Roll back the shoulder. Shrug. still sticky, huh?
Yeah.
Again, abduct first.
Okay.
And shrug. Almost. It's still a little sticky there, isn't it?
Yeah. Oh, that feels better.
What happens right there?
I don't know.
Do you feel tension in a particular area? See, it's done.
In my arm. Right there. No, right here.
Delt.
Yes.
Is that different?
A little bit.
Not much.
That's good.
There we go. Wow.
That's more than I've been able to do in a long time.
Yeah, that got. I don't know what just released, but something just relaxed.
Yeah.
Shrug and abduct. There it is.
Mm-hmm.
Nice. I'm pain at the top of that.
A little at the top.
You want to push it towards the end.
Mm-hmm.
So you walk backwards. Good. It's almost there. Okay.
Yeah.
Let's see this plyo thing here. Let's see. Well, adduction's high quality. Let me go check both here. There you go. Is that peg? There you go. Yeah, try to find your lat for this. So think about pulling like this, not like this.
Okay.
So pull. Yeah, this is chilling, right? You feel how that's not working? And
Yeah.
now it's more back there.
Uh-huh.
Good, hold that. And then we're gonna plyo this out. So keep your lat on, keep pressure in my hand. Yep, not with this.
It's hard.
Feeling the lat?
Uh-huh.
Keep that lat on, keep that lat on, keep the lat on. Good,
Yep.
good. How's your shoulder sensation?
A little bit of pain. It went into the delt, I think. Right in there, yep.
That make it worse.
Better.
Yeah. Nice. Okay. Let me check your internal rotation again. You okay?
Mm-hmm.
Hold this way. Hold. Ready to go. Okay, let's work that too. So start neutral. Start turning in, towards your body, like you're going that way.
Oh.
Right there. That's it. Don't let that shoulder roll forwards. This is more anterior, so this you should probably feel. You feeling pecky a little bit this time? Yeah.
Yeah.
And then we're gonna plyo. We're gonna plyo this one out. So keep that pressure on my fingers here. Yep. I don't know if it hurts the shoulder at all.
Shoulder wants to go, but I'm gonna try and keep it back.
Yeah, just don't let it go forward. You're doing good. Cause we're moving
Right there.
it. Pain.
Mm-hmm.
Let me check something else here real quick. You okay there?
Yeah.
Pain.
Just a little pinch in the delt again.
And this one.
Is my delt like overcompensating? I don't know.
Or not letting go, yeah. Pain.
A little bit of a pinch, yeah.
Let me check through the forearm. Turn it in. Hold that position. I'm gonna try to unspin it. There you go. That feels good. Stay that way. I'm gonna try to spin it in. There you go. That's not great. So supination you don't really like to do. How's the neck feeling? You okay?
The next, fine, yeah.
So we did a little bit of glenohumeral internal rotation. We did some adduction plyos that didn't really clear it there. So we do more samples, forearm, low quality and supination. And then I'm really interested in this pinky. You do some weird stuff with this finger. It's always off in its own little world over there. I want to check something through there. Hold that. I'm going to try to bend it. There you go. Feels okay? No pain?
No pain.
So come with me. There you go. You're all ready to resist every time. hold it there. And go. That's pretty good. Okay, and then extend it. Hold there. There you go. That's a problem. There you go. Let's put that for a second. Open that into me right here. 10. You should go some 8, 7, 6. And think about kind of going light. Like think about what the band does to your tibia. Same thing will apply if you go too heavy. And rest. While that's resting, you check ulnar deviation. Stay there. There you go. That feels okay. Hold. There you go. That feels pretty decent too. And then we check the pinky. Hold. There you go. Did you ever break this or smash this or
No.
anything?
And we just go hypermobile. I just like overextend all my.
It's just, yeah, it just moves weird, this one does. Okay. Let me check the shoulder again here real quick. Come out this way. Okay.
It's way easier if I keep my shoulder back, like intentionally in my head, I'm gonna keep it back.
Let's turn that on a little bit more. So smash my fingers in the table. Yeah. That should be like where the tip of my fingers are, maybe any more that you're feeling the work. Is that it? Like
Yeah.
along that shoulder blade edge there?
Yeah.
Good. Yeah. Working pretty good.
Yeah.
Yeah, more again medial from my fingers, so further in.
Right.
And rest. On the back. Abduct. Start to shrug. There we go. Oh, look at that. Yeah. So the only other thing I'm really interested in is this supination, right? Because as you're going into that abduction, you have to be able to maintain that to not get like this.
Yeah.
So let's run this supination real quick. I'm gonna have you just start by spinning the hand so that it starts to face you. There, right there, that's it. Should be some forearm work, maybe the elbow, and it might even go up into the bicep shoulder. Do you feel a little?
Yeah.
4, 3, 2, rest, and then spin all the way out. Other way.
This
Yeah,
one.
yeah. Spin,
You
spin,
have to
spin.
look at it to know.
Yeah, you can look at it. 1, nice. Again. 2. Again. 3, nice. Yeah, you feel all the way up the arm.
Yeah.
4. 5, and then rest, and then we'll recheck quality here in just a second. Good. So we're getting some supination. We saw kind of a pinky extension. So the 5th metatarsal. Overall quality seemed like that got better, but didn't really change the shoulder. So, supination on the left. Do a quick ISO. Do some miles. Let's recheck quality. Bring it that way. Hold that position. Ready and go. Feels a little better. Like it didn't at first. Did you feel that? The first
Yeah.
second or two, it was like ah, and then it got it. Okay. Open out, abduct. Start to get your shrug there. Try not to lift off the table. Pain.
Right there, yeah.
Okay, relax. No pain.
Okay.
Okay, try to stay relaxed. I'm gonna passively move you a little. Pain.
A little bit right there. Pinch.
Okay, shrug.
Adults again.
We got a little further, still doing that. Okay. So there's definitely something to this, but I still think a lot of it's coming from either your neck or your trunk and spine. Because we're getting some changes, we're getting things to high quality, but it's not greatly improving that abduction.
Yeah.
And it might just take some more time too, but I don't want to just be like, oh yeah, it just needs more time. I want to make sure that there's not other things getting to it.
Yeah. Well, I've been telling myself it's like an injury that needs to heal, but it's been 2 years of.
And it's possible that you're re-injuring it along the way, so maybe it does need to heal.
Yeah.
Because if you're malusing it, it could just be basically re-tearing every time you use it wrong.
Yeah.
But I also see your point. Let's bend the knees. Okay, we're gonna go chest real tall. Good. And shrug. At the very top again?
Yeah.
Okay. So definitely also, again, the trunk and spine, there's something to this. Let me go back into the neck here a little bit and we'll double check this again. Let me get this out of my way here. Okay, there we go. All right. Let me check your capital flexion, cervical extension stuff. So keep the chin tucked. Hold that position. I'm gonna try to untuck you. Ready and go. Definitely better than it was. Good. Keep your head down. I'm gonna push you up. Keep the head down. Ready to go. Good. Feels high quality.
Yeah.
Okay. I'm gonna kind of pull you out here a little bit. You okay there?
Mm-hmm.
Try that left shoulder.
Yeah.
That helps, doesn't it?
Yeah.
Compared to, try it again.
Yeah.
It's better when we're in that big extension.
Right.
Okay. So I think what we want to do is work this cervical and thoracic extension. I'm going to have you go face down. And we'll get your face down here. This should feel like a down angle here, right? Your neck should be low.
Glasses off, maybe.
Yeah, that's a good idea. Okay. You okay right here?
Yeah.
No pain in this position?
No.
Okay, just for fun while we're here, before we do the neck, let me see this, see what effect this may have. Now I'm seeing it's getting real funky in there.
Mm-hmm.
Did that hurt almost?
It didn't hurt, but my shoulder's probably not for sure.
Pain?
Belts again.
Yeah. That's gonna make it worse. Okay, retract the shoulder blade, hold back, hold that position. There we go. Okay, that feels okay. Alright, we're gonna work the neck. Sorry, I just wanted to check that here. Okay. So getting into the neck, what we're gonna do is run a cervical and capital extension. So that same move that we were working last week when we were face up, but we're adding more gravity to it now here, right, by doing it this way. So I'm gonna have you lift your face out of the face rest, but keep your chin real tucked. Yeah, that. Did you feel that pop the chest tall?
Mm-hmm.
That, right there. And then without moving your chest or your back too much more, try to bring the head back down. Try to keep the back tall.
Down.
Yeah, there you go. And then chin stays tucked, lift. Good. And then slow back down. Chin stays tucked. Good. We're in a big cervical extension here. This is wonderful. You're getting some work down your spine.
Mm-hmm.
Yeah. Yeah, right. So now lift a little bit more through the head. So the head gets behind your body. That. And then back down. Beautiful work. Let's go. Getting this worky all the way.
Yeah.
Head. Keep going with the head a little more. Good. Yeah. Getting a big cervical extension there. Nice job. Starting to get tired?
A little bit.
Okay, give it a couple more and then we'll recheck again. Good work. Getting close to that 4 RPE. Yeah.
One more.
Mm-hmm. Good. And then rest. Give it a break. We're gonna do one more set, and then we'll flip back over and recheck the shoulder stuff. I think this will likely be a homework exercise that we set up for you,
Okay.
just to progress it from last appointment. Are you relatively comfy in this position? You okay?
Yeah.
What we're really working here is the same thing, right, from last time. We're just adding more range of motion to it and more load via gravity. Face down. Take out 10 of those guys. Get this rolling here because we're going to set this up for your homework. Give me just a second and we'll run a second set. So what we're working on this one, right, is just recapping the homework, doing a cervical extension and capital flexion. But we're doing this from our prone position so that we get more force application through gravity and more range of motion so the neck actually gets to extension. So just keeping your head tucked a little bit, chin, yeah, and then coming up. And then slowly untucking the chin as you keep the head moving behind the body. Yep, and that's about it because you don't want to kink it at the top there. Nice job. 1. And back down. Beautiful. And you'll keep that ball rolling. See if we can get to 10 again. 2. Excellent.
So lift up and then chin down.
Yeah, and then as you're getting the head behind your body more, you'll have to tilt the, so at the top, stay at the top there, and tilt a little bit the chin and get your head, other way, sorry, and get your head behind your body just a tad. Yeah!
Got it.
There it is. That's a real cervical extension. Yep. Good job. Just a couple more here if you got it. Starting to get a good burn. Nice. I'll let you ride it out until we get to about that 4 RPE. If it's there, it's there. Nice. Doing okay?
Yeah.
Getting work all the way in the neck and all the way in the spine?
Yep.
And now your head's behind you. That's beautiful.
Yeah.
Okay, good job. And that's rest. And then let's flip you back over. And we're gonna see how this shoulder thing feels there. Okay. Oh yeah, sorry. You need that to see, don't you? Okay.
I feel like Velma.
Can't see anything without them. I'm pretty sure they've like, I've seen episodes where she, you know, they pull the mask off for the people and she still can't tell who it is because she didn't have her glasses on. I'm pretty sure I've seen that. Let's check this. Slide, just, yep, abduct, slide it out. Try not to lift it off the table. Right here you can get a little twist involved. It hurts when we twist out, it hurts more.
Yeah.
So if we don't twist you out, it's better than if I go there, okay. Better?
Yeah.
Almost there. Okay, so last check in terms of the neck relationship to the shoulder. Scoot your head up so that we can get you in extension on here. So I want you to feel like your head is going backwards a little bit.
Yeah. That.
Yep, you're wearing that cervical extension, right? Like the same position we were getting to the end of that movement a second ago. Try this again. That's better, isn't it?
Yeah. The pain's at the very end in adults again, but not.
Right here. Okay. And then I'm gonna scoot you back down. I wanna check one more thing to the neck here. Doing okay?
Yeah.
Nice. Alright. So, I wanna check, do a kind of preliminary cervical effect screen, and this is gonna tell me if I think we should go this way next time. So, I'm gonna get your head all the way over to the left, and to the right side. Try that left arm.
Better.
And then shrug. There you go. That was much better, wasn't it?
Yeah.
No pain at the end there?
A little bit of a pinch, but not pain.
Okay. Now try it. You won't get as far, but I just want to know if it feels better. That's worse, isn't it? Yeah. Okay. Keep this left rib cage packed real good. And that again. Worse.
Spots there.
Yeah, it's stucky. Okay, let me check some right little pelvic flexors here. I'm gonna have you hold on to the edge of the table. Yep, and then I'm gonna have your legs in a slight flexion. And then bend this way. Use the trunk and spine to bend. Yeah, hold. Ready, and go. Nothing.
No.
Hold, ready, go. Nothing. Okay. Bend your knees. And then I'm gonna get you up here. Hold. Ready, go. Yeah, that's better. Okay. Spin. Yeah, so that this gets a little hikey in there, right?
Yeah.
Hold that position. Ready, and go. Okay, so that you have two. Okay, back out. You okay?
Yeah.
And then both legs together. Push your legs to the right. That. I want you to feel some core work over there.
Yep.
Yeah, right away, huh? 10, 9, 8, 7, 6, 5. Keep pushing. 4. Good. 3. Don't let up. There you go. 2, 1. Nice job, Amanda. Take a break, and then we'll do that one more time and recheck it. You okay?
Yeah.
Okay, just work.
It's just work.
Was that anterior or more posterior?
More posterior.
Okay, let's try to find the anterior here. I'm gonna help you with the spine a little bit. Give you this pillow. There you go. So that we're a little bit more flexed. And then when we lift the legs, I want you to feel that low back rounding. Instead of arcing when we do it. Can you feel that rounding down there? Like
Yeah.
you're doing the crunch almost?
Yeah.
Okay, now move them to the right. I want this to be more anterior.
Definitely is, but it's hard.
Ah. A little easier if we're there.
Yeah.
Yeah, keep that anterior tissue on. Keep that on. So you're gonna keep pushing that way and keeping that tissue on, and I'm gonna slowly bring it down. Keep that anterior tissue on as much as possible. Got it? Started going posterior?
Yeah.
Yep. Okay, let's go again. Push right. And rest. Okay, little break. Let's go ahead and check that left shoulder again. Just slide it up and out.
The pillow there?
Oh, sorry, the pillow's in the way. Perfect.
Much better.
Oh yeah, look at that. Wow. Okay. No pinch?
A little bit, but it's not as bad as it was.
It's moving really good.
Yeah.
Tighten here. And do it again. Less pinch.
Yeah.
Yeah. Come this way. And do that again. All good there?
Mm-hmm.
Yeah.
Yeah, I don't, I mean, you would know better than me. But I also feel like after we do a bunch of stuff with this side, it just starts to feel better to me.
In general.
Yeah.
I know.
Whatever you do, it's like it helps it heal more.
I kind of want to add a bunch of moves to this actually, because I kind of want you to lock in the supination, which was this guy.
Uh-huh.
I think I want you to work the internal rotation, because that was low quality too, just so we can rule all these things out, right? Because let's say you practice them this week and you come back and those are all high quality, and there's still some limit in here, then we know at the very least it wasn't those guys,
Yeah.
right? I still think this is more about necky stuff, is what it really seems like. Let me double check one thing on the neck and then we'll decide what we're going to record here. Lift your head. Try the shoulder.
Way better.
That's better.
Mm-hmm.
Okay. And then relax, put your head down. Do it again.
It's right there.
Yeah, worse again. Okay. And then head up. Chin up. Try it again.
Yep. Way better.
Way better, huh?
Yeah.
Okay. And then head down. Sorry. Yeah, there. all relative.
Down.
Which down? This one? That one? Okay. Chin up. Try it again.
A little better.
But not as good as
Not
when
as
your head is up.
Yeah.
So the reason I had to do the cervical extension stuff was exactly that, right? So this is good, and then down is not. So I'm like, well, let's reinforce this down. But what it might be is actually just feeding the beast instead of switching the food up, actually feeding this flexion. I'm gonna plyo you from flexion to extension.
Okay.
So lift that head and tuck the chin. Okay. And then just like that move on the way down that we did, you're gonna control this down. So keep your chin tucked and pressure into me here. And then just enough that I can push it down. Start slowly moving down, but keep pressure on me. Yeah, it's like you're setting something down gently and slowly, right? Yeah, retuck. Yep. Nice, let's do that. Take a break and then we'll do it again. You okay?
Yeah.
Let's try again, lift. Pressure a couple seconds and control it down. You'll feel right around here, the chin up. Yep, right? Keep your chin. Oh, nice. Good job. Take a break and we'll do that one more time. I think we probably want to do this one even more than the other shoulder stuff. This looks like a big deal here, actually.
Yeah.
Let's try this again. Okay, lift your head. Perfect. Control it down, keeping that chin tucked. Nice. And then one more time. Lift. Chin tucked all the way to the table. Oh, nice. That last little bit, right? Give it about 10 seconds and then we're going to recheck that abduction one more time. What I think should happen here is that it'll feel a little bit more like when your head is up. So try it again. The left shoulder.
Oh. Much better.
Yeah, look at you. That's like almost full range.
Yeah.
Just to compare to the right, do it with the right side.
Yeah, no problem on the right.
Yeah, it's almost there. It's
Yeah.
almost there. No pain at the top of that motion?
No pain.
Okay, one more thing on the shoulder here. Go up. Go this way. No pain?
Pinch and the delts again. Yeah, that's better. Pinch right there. Pinch. So much better than it was.
It's moving a lot better than it was.
Yeah.
I think you might actually be onto something too, that it is possibly not fully healed. Because it's like what we would call, and I don't like this diagnosis, but it's what we would call frozen shoulder.
Yeah.
It's just locked up, right?
What's weird, and this is something I don't understand, is I would do things that I would think were gonna re-injure it. Like, my boyfriend tried to help me up a cliff, and I used his shoulder, and I was like, oh, I just fucked it up really bad, I messed it up, and then the next day it was like better. Like, how does that?
It's just shock factor too, right?
Yeah.
Something new, you know? It's like, oh, wait, what? Because anytime you do something new, whether it's physical or not, even if you're rationally and cognitively in control so you don't notice this, there's always this, huh? What?
Yeah.
So I
Yeah.
wonder if,
And I'm also holding it, I was holding it all the time.
Yeah.
So it's like no movement at all on it.
right, so some movement is probably going to be a no movement as long as it's not pain. Now, what's interesting about what you just described is it's the same way that it got injured, basically,
Yeah.
right? Getting yanked out.
Yes.
But I think you holding onto him was yanking it back in.
Huh,
Do
okay.
you see what I'm saying?
Yeah,
So I think it
that makes sense.
yeah, because otherwise he would have just pulled it out again. But your body had to go
Right.
to lock it in, which is this kind of system we're looking at. What really? That's it. I was like, why can't you depress, retract? Why can't you do that, right? And that's the problem itself, is not being able to do that. The questions that we're playing with right now are: is it because the neck's in the way? Because the thoracic spine's in the way? Because
Right.
some of those muscles are off, right? And it seems like maybe it's some of each of those things, which is what's really interesting.
Huh.
We're gonna try an abduction retraction here real quick. So reach to the ceiling. Now I want you to think about, feel the shoulder blade. If I pull you, right, it pulls it out, which
Yeah.
is essentially how it got injured.
Yeah.
So as you abduct, you're gonna pull that back. So start pushing outwards this way.
Outwards.
Yep. Yeah. All the way to where the arm's gonna be on the table. So yes, it's arm, but also shoulder blade. Yeah, you feel it?
Mm-hmm.
Try not to go up. Stay just straight down here. Yeah, right towards my finger. Keep going. Keep going. There you go. Keep going.
It's right there.
Okay, rest. Bend your knees. Chest real tall. There we go.
Mm-hmm.
Spin. Spin. Other way. The whole arm. Good. I'm just trying to loosen it up a little bit.
Yeah.
Spin. Spin. There you go. Okay, and then here. And out to the side again. Pull that shoulder blade back. Yep. Pulling that in.
Yep.
Better, huh?
Better.
Almost. And the delt again?
Yeah.
Let me try one more thing. This is kind of an MAT type thing, but let me try this. Does that kind of hurt?
That's good. Hurts but feels good.
Yeah, yeah,
That makes
Some-
sense.
Yeah, like sports massage pain.
Yeah.
I'm hoping to get a little bit of that. Shrug. A little tender there too.
Mm-hmm.
Ooh. A little bit of pain? Like that. Good. A little bit there too.
Yeah.
And then do that this way. Better?
Yeah, better.
Not pinching?
It's pinching, but it's different.
Like less intense?
Yeah.
Okay, and then last test. Just get to here. No pinch at this angle.
No.
Hold this position. Ready and go. Ooh. Ready and go. Ooh. That, there we go. Hold up. Hold here. There we go. Good. Just keep plowing that out. Feel the pec.
Mm-hmm.
Keep that pec on. Keep the pec on. Keep the pec on. No pinch.
No
Keep the
pinch.
pec on. Keep the pec on. Keep the pec on. No pinch.
When I let go of the pack, it was.
Yeah, right. Okay, one more time. Pec. It's gonna be harder the further out we get to keep it on. And again, I'm not worried about the force. Like you can go kind of light on it if you want. I'll let up, but keep it on. So pressure into my hand just a little. There. Pressure into my hand again. Yep. Pressure in the hand again. Yep. Pressure again. Yep.
Wow.
No pinch.
Right there.
Yeah. Okay.
It's working though.
And rest. Yeah. Good. Okay. So I think we made some pretty good headway on this shoulder again. I'm gonna be interested to see what your feedback is for this.
Yeah.
Just how it feels after all this extra work this week. So next appointment, what we're gonna do to it is I really want to rework this like abduction thing you're doing here. So this is like transverse abduction, right? We're working on the frontal abduction as like our baseline,
Yeah.
but this transverse abduction was low quality too, right?
Right.
You couldn't hold that at all.
In Pilates, I can't go into a T.
It's that's why, yeah, because those muscles aren't on for whatever reason. So we'll keep playing with this left arm transverse abduction, which is like retraction, abduction, maybe a little external rotation. I don't think the pec plyo is going to do it, but it did get you further a little bit here today.
Yeah.
I'm more interested in myo isoing that thing. We might even need to pop up and go do a little retraction or something on the machine.
Okay.
So the one thing that I'm going to have you do is just work the neck. This cervical extension, I'm leaving a voice because I need to specify. The cervical extension, capital flexion, right? So face down, you can do it just hanging your head off the edge of your bed.
Yeah.
getting it behind you without kinking it at the top.
Okay.
Right, so that chin might come up a little bit, but you don't want this.
Yeah.
And we got a video for that, so I'll upload that on there for you. And I'm not going to give you any of these arm ones yet.
Okay.
Let's see how this goes first. What I'm trying to do is separate the variables. We did a lot of work to the arm today, but I want to know if doing the neck all week is going to make the arm better.
Mm-hmm.
If it doesn't, then we're going to go right back into the arm. And like I said, we're going to work this transverse abduction through the left. Maybe even pop up on a machine and do it with a retraction machine over there to help us target that a little bit more.
Okay.
Because that makes a lot of sense, right? You can't hold that retraction abduction.
Yeah.
And that's the problem with getting there. Every time you go this direction, basically does this instead of that. And some of that is coming from the spine. We know for sure, because when we get you flexed here and extended through the thoracic spine, it moves better, pinches better, and that's what we've been working on, and it's still better than it was 4 weeks ago.
Mm-hmm. Yeah.
But I want to, we're picking the lock. I want to find the master key, not have to pick the lock, right? So does that make sense?
Yeah.
Okay, awesome. So that's where we'll take this next time.
Okay.
Good job. All right, thanks.